and welcome everybody to a conversation with Brittany Kitt from AARP DC. Tonight we'll be discussing caregiving during the COVID-19 pandemic. It's my absolute pleasure to welcome Brittany Kitt, who is the director at AARP DC, a licensed graduate social worker, as well as a lobbyist and a graduate of Howard University in Washington, DC. Welcome, Brittany.
Thank you for having me.
You're very welcome. So we're gonna jump right into our interview. This is a very important issue tonight that we're discussing. And those of you who are joining us via Zoom, welcome, via Facebook Live, welcome. And I am just so honored to introduce Brittany to our audience. She really has a heart for the elderly and for caregiving. And certainly we know that life has changed, but let's talk about what life looked like prior to 2020. America had not experienced a pandemic in many years. However, there were many caregivers caring for loved ones. How did caregiving look, Brittany, prior to COVID-19?
Yeah, so I think that's, and again, thank you for having me. This is an important conversation. And I just want to start off by laying the framework, right? So giving you just the layout of what caregiving looked like. And so I brought with me a few statistics. So the most recent data prior to 2020, which was populated in 2015, was that there were 43 million adult caregivers in the United States. Since then, the most recent data, which came out in 2020 and can be found on our AARP site, there are an estimated 53 million known caregivers or adult caregivers in the United States, right? So that population has grown tremendously. You know, it's one thing to talk about it in terms of numbers, but if you talk about it in terms of a ratio, that means 1 in 5 Americans is a caregiver.
Oh my.
Right. So this population is very real. I want to point out that 24% of caregivers are actually caring for more than one recipient. So they're caring for 2 or more people. And 1 in 4 caregivers is actually a millennial, which means that they are between the ages of 20 and 40 years old. So this is a very large population. You know, there were always challenges with caregiving. I think many of those, you know, which we'll get into, have been amplified, but they are here. We have, you know, baby boomers who are aging, needing care. We have more people who want to age in the community. So as a result, you know, there are a lot of caregivers in the community providing that alternative versus being in a long-term care facility. And we also, I definitely want to point this out, have more people who are now self-identifying as caregivers, which accounts for that increase. We talk about stigma, for example, in communities of color, or particularly in the AfricanAmerican community. How do you identify with caring for a loved one? Do you identify as that as an obligation, or do you identify it as I am actually a caregiver? And so, 53 million adults in the United States right now, and the caregiving population is very present in the United States.
So Brittany, I'm just curious, in your experience, do most people in the African-American community identify as a caregiver, or do they view it as an obligation?
So I don't want to, don't quote me on statistics, but I can say culturally, right, that, and this is not just the African-American community, we're talking about, I've done some work with Native Americans, right? Many people see that as part of the life course. You take care of your loved one. When someone ages, when they need you, you take care of them. If your church member needs something, you care for them, not knowing that is called that it has a name and that it's called caregiving. And when you identify as such, you then open up a whole new world of resources and community and things that you may not have known were available.
Do most individuals in the African-American community identify as a caregiver, or do they identify as this being an obligation?
Yeah, so I was saying that, I can't give you statistics right now, but what I can say is that many communities, so I've worked, I was mentioning that I've worked with, the Native American community, right? So many
Yes.
communities of color, as you go throughout the life course, you're taking care of someone who, is disabled, somebody had a stroke, somebody, your church member needs something and you're their main point of contact. And so not necessarily identifying with the title caregiver.
Okay.
And when you do identify as a caregiver, it then opens up this other world of resources, of support systems, of services that you did
Yes.
not know had were, available to you.
Okay. Thank you for sharing that. So, what challenges did caregivers experience prior to COVID-19?
Yeah. So, caregiving is one of those things that is rewarding. I think we can acknowledge that, but it's challenging. And so some of the challenges have been just the complexity of what it means to be a caregiver. You're oftentimes managing complex tasks. And I would say if you're a young caregiver, you may be managing things that you have never even managed for yourself, right? So we're talking about
Mhm.
financial planning, finances, just managing a checkbook, right? Coordinating medical care or in-home services. Um, Something that has always, been something that has taken me back is the fact that most caregivers on average are providing 20 plus hours of caregiving per week. That's a
Mhm.
lot of time, right? So
Yes.
talk about that. That then brings up the issue of work-life balance, being able to manage
Mhm.
your work, being able to manage if you have children, other aspects, your self-care, and that leads to what we call burnout. And so these are just some of the
Yes.
challenges, but I think if I, had to pick one, it would be the burnout would be the biggest challenge.
Okay. And we're certainly going to revisit that and talk about how we can make sure that we try not to burn out a little later in
Right,
the conversation.
right.
Brittany, prior to COVID-19, how were the daily operations structured at AARP DC?
Sure. So AARP, I should point out, has a national office, which is in Northwest DC. But in addition to that, each state has what's called a state office that is a 501c4 focused around advocacy and community outreach. So our permanent office, which we are not working at right now, we're working remotely, is at 100 M Street Southeast. If you can't find the address for some reason, it's right off of the Navy Yard Metro, across from the National Stadium, so you can't miss it. And that was our office space, but most of our work actually took place in the community. So myself, my counterpart, Peter Rankin, our state director, we are very, very heavily focused in the community, working on I would say two pockets of work. So advocacy, that being we're weekly down at the DC Council building, checking in with council members to advocate and discuss arising issues in the area of aging, right? We're talking to Congresswoman Norton about legislative needs that are needed in the District of Columbia. But then our other pocket of work is our community outreach. So we are deeply embedded prior to COVID-19 in the senior centers, we're attending ANC meetings, we're attending at sometimes church services, wherever we need to go so that we can engage with older adults and also make sure that we're hearing from them about what their needs are and what they need as they age.
And I can attest to that because I met Brittany in the community at a community event, and
Yeah,
she was, letting the community know about the services that AARPDC provides. So that is 100% true.
yeah.
What resources and support services did AARPDC specifically provide to the community prior to COVID-19?
Yeah, so piggybacking off of the what I just said about community outreach, much of our information focused on fraud, so consumer fraud. There are so many utility scams that you can't even keep up with. When you think you've identified one scam, for utilities, then there's another scam that comes out. You talk about lottery ticket scams. There's so many different scams. So we provide information on that. When I'm met you, I was providing or providing information on caregiving.
Mhm.
We also do trainings on driver safety, and also prior to COVID-19, we were about to deploy some of our trainings on the 2020 census. So we are, out in the community on various issues, but I will say, you might find us in the community, just speaking with people who want to volunteer with us, just speaking with people and having a coffee about whatever they want to talk about with us. So of course, those are the major pockets that I would say we do community outreach on. But honestly, anything that somebody that is aging related, I will engage with a senior on in the community.
Okay, thank you for sharing that. And now we want to transition to when life changed for us here in the metropolitan area around March of this year, late March. And you referenced that there are over 50 million caregivers helping loved ones with care in the United States. We expect the virus to increase the number of family caregivers who are providing short-term or long-term care. What challenges do you believe the projected increase will have on family members who are caregivers?
Mm-hmm. So one of the unfortunate situations that happened, as many know, thousands of people have died in long-term care facilities. So people who had made that tough decision of putting their loved one in a long-term care facility made the hard choice of taking their loved one out of the facility. So you're taking people out of the facility in moments of panic, right? So then the challenge that you run into, right? This talking about this projected increases, you have new caregivers who may not be well connected to services, right? And
Yeah.
so they're sitting there like, what did I get myself into? What am I supposed to do as either a short-term caregiver or now taking this on because my loved one, we're going to explore home and community-based services. So for those caregivers, I think the biggest thing is, and the projected increase in that particular population would be that people have taken their loved ones out of facilities and now are needing to access resources.
Mm-hmm.
Yeah, but all in all, the challenges in caregiving, I think, are the same. That burnout, the need to know where services and support are, but with that, those being now amplified by things like trying to balance, working from home while the person
Yes.
you're caring for is next to you. I don't think we talk about this enough, but now you're going to have to homeschool children, work from home,
Yes.
and care for someone, right? And balance
Yes.
your marriage, and
Yes.
try to get self-care. So, these are hard decisions that people have had to make. And for some people, it's not even a decision. It's something that people have no choice but to do. And so, we're just trying to make sure we get resources out to those people to help.
And those resources are so important, Brittany, because if you take a loved one out of a facility, bring them home, even when we come out of this pandemic, it may be a while before you can get your loved one back in because of waiting lists and lack of availability. So these resources are very important. So how has AARP adjusted daily operations to support caregivers now in this platform, in this space?
Yeah, so most of our work, well, I wouldn't even say most of our work, all of our work, we've had to rethink and do in creative ways. I would say the majority of our work is now virtual, right? So we are referring people to our AARP caregiver resource page. As a quick note or a quick plug, the page for that is www.aarp.org/caregiving. But honestly, if you go to aarp.org and in the search box type in caregiving, it'll take you right to the site.
Okay.
But making sure that on that site, there are resources about burnout, local and regional resources, identifying affordable in-home care options, and also resources for different buckets of caregivers, right? So we have millennial caregivers, we have caregivers of color, we have, which a lot of people aren't talking about, male caregivers, right?
Mm-hmm.
And so trying to make sure those resources are readily available. In addition to that, much of our work that, isn't caregiving related necessarily, like our census work, our voter engagement work, all of that we are transitioning and doing virtually. So one of the highlights and that our office is really proud of is our work we are starting for voter engagement. So we currently have 4 confirmed trainings we will be doing in collaboration with the DC Board of Elections. The idea is that we're offering that to the public so they can learn how to vote. How do I ensure that I have voter access, that I have the option to vote safely if I, for example, have a pre-existing condition, and then also knowing real-time information. Things are changing. 2 weeks ago, there were 40 polling sites for you to go to. Now there are 80. So making sure that we are providing real-time information, and we can't be in person, but that doesn't change our work. One other thing that I want to point out is that we are tapping into our volunteers who are in the communities, right? So we can't go out into the community, but our office is led by volunteers. So we have what's called ward liaisons who represent the different wards of the district. So, wards 1 through 8. We also have people who consider themselves at-large ward liaisons. Those individuals will tell us what's happening in their community. We will share resources with them, and then they themselves can call their churches, can call their community networks, and disseminate that information. So our work doesn't stop. We just have to be more creative.
Okay, that is wonderful. So if someone was interested in volunteering at AARP DC, how would they get in touch with your office?
So I'm actually going to give my work email. You can email me at bkitt@AARP, that's BKITT @AARP.org. You do not have to be a district resident. Typically what we do is if somebody, wants to volunteer, but say they live in Virginia or Maryland, we will first refer them to those offices because there's work in that space. But then again, there's people who live on the border and they are heavily invested or have lived their entire life in the district. So we will work with them and find ways for them to get involved. And I just want to point out that you really can tailor your own volunteer experience. There's some people who say, I only have 1 hour a week, or I have 2 hours a month. And so we always have various options and ways for people to engage.
Okay, so for those of you joining us via Facebook Live, you can reach Brittany at bkitt@aarp.org. Brittany, how have you seen the pandemic specifically impact caregivers and the elderly in the district?
Yeah. So the last number I had, I want to say there were over 30,000 caregivers in the District of Columbia, right? So we're talking about a huge demographic of people. Many of them were connected to respite services, connected to adult day health cares. They had services they were receiving at hospitals. Well, much of that stuff has changed, right? Because those services are closed, right? They're not available. So, where you got that 8 hours of adult day health programming where you're able to drop off your loved one, now you're having to make up by either paying out of pocket for care or potentially, now having that person at home with you. So having to make those alternative arrangements, I think is, one of the biggest impacts that have happened. In addition to that, we recently interviewed Marla Lahat. She is the owner of Home Care Partners, a home health agency that also is a grant recipient and operates the DC Caregiver Institute. I want to say they serve upwards of 130, maybe to 150 caregivers. And one of the things she pointed out to me is that there's actually a shortage in home health aides, trying to care for all of these, new individuals needing in-home care. And then also you're talking about, infection rates of frontline workers like home health aides. What happens when the population of home health workers declines, right? So they are working, the health network is working through those issues. But just know, there are resources to help. There are places to go. If you are impacted. And I just want to point out one other thing. Unemployment is real, right? I want to say in the US, the unemployment rate is about 10%. So where people might have paid out of pocket for in-home care, people can't afford those things. And so they have to make alternative arrangements. And, that's challenging for our population, especially here in the District of Columbia.
I'm glad you mentioned unemployment. For those individuals who have to take care of their loved one in the home and they cannot afford to pay for outside or in-home services, what suggestions would you give to them?
I would suggest reaching out to DC Office on Aging. So
Okay.
it's DC. Well, it's actually not office anymore. They're a department on aging and community living. So every area on aging, if you have listeners that aren't in the District of Columbia, no matter where you are, there is an area agency on aging. Each of those has what's called an Aging and Disability Resource Center, and it's a one-stop shop for information. And when you contact it and what's called an ADRC, that would be the acronym, right? You can tap into what's called waiver services. So for individuals who may not be able to afford, in-home services, or they may meet the Medicaid income threshold, there are actually waiver services where it doesn't cost you a dime. And not only does it, when you are enrolled in those types of services, are you able to tap into in-home care, you're able to tap into physical therapy, occupational therapy, respite services, all paid for by Medicaid. And so it's always important, even if you think you're not eligible, tap in and try to figure out what you are eligible for.
That's a very comprehensive list. Can you go over that again? You said physical therapy, occupational therapy. What else
Yes,
did you say?
so for example, the elderly and persons with disability waiver, I want to say they have about 9 or 10 services. So I'll just list the ones that come to my head right now, but
Okay.
respite services, which provides short-term relief, occupational therapy, visiting nurse services, meals, home
Mm-hmm.
delivered meals. Um, of course, your in-home care that can be anywhere from 2 to 4 hours, and in some special cases that are approved, all the way up to 24 hours of care. So
Thank
there are
you.
actually people who live independently through the EPD waiver, and they have 24-hour care, and as a result, they can live by themselves.
Thank you, Brittany.
Mhm.
I know that you have a soft spot in your heart for working with individuals that have dementia and Alzheimer's or Alzheimer's. Can you make the distinction, explain to us about the two different illnesses and what strategies you would give for those taking care of individuals with dementia or Alzheimer's?
Yeah, so dementia, if you break down the term, what it actually means, it really just means memory loss, right? And so there are different types of dementia, one of those being Alzheimer's disease. Someone can also have dementia from something as small, or for some people it's major, a urinary tract infection, which can cause acute dementia, right? So there are different types of dementia that you can have. Alzheimer's disease is one, and disproportionately impacts people of color. I do want to point that out. And so there are, resources to help in that arena as well. Prior to this role, I operated DC's dementia, many of DC's dementia programs. So, a Saturday respite program that is run by Iona Senior Services. There is a money management program for if you're caring for someone and they live by themselves and they just started having that cognitive decline, but they can still, they can still cook, they can still run errands, but you're uncertain if they're going to pay their bills that month. There is a money management program that can assist them with that without taking away their independence, right? So
Mm.
making sure, again, you're, contacting places like the DC Caregiver Institute, or, DACL's Aging and Disability Resource Center. You can access resources that way. I also want to point out that, Alzheimer's disease, is a particular illness, right, where you may need support, right? You may want to tap into a support group where there are other caregivers of individuals with Alzheimer's or other forms of dementia, to make sure that you have that social network. So one service that I love is Sibley Memorial Hospital's Club Memory Program, which is both a support group and a social club for the caregiver and care recipient. And so they do, they'll do games, they go on outings, but they also provide that support, and they have licensed professionals to operate that program.
Oh, that's amazing. And that's Sibley Memorial Hospital in Washington, D.C. And what is the program called?
It's called the Club Memory Program.
the club memory program.
I want to say the last time I checked, they had over 800 people in that program, and they operate in several wards. So they have different locations that they go to throughout the month and operate the program.
Thank you for sharing that. Brittany, one of the concerns that many people have, and a lot of people wrote this in for their questions, and I weaved it into my questions. What would you say to people who live out of state and they cannot physically be near their loved one that is elderly during this COVID-19 pandemic?
And I'm going to make the assumption that a lot of those caregivers are caring for people who are in long-term care facilities. Yes, I'll speak about that first.
Okay.
Well, actually, no, let me speak about individuals in the community first. So again, going back to aging and disability resource centers, when you tap into them, they're one-stop shops, not just for receiving information, but also for enlisting the help of somebody to help you coordinate that care. I know when I'm stressed out and I have a whole bunch of different things in the air, or you go to a new job and you receive a whole bunch of information, it's really hard to absorb that information, right? So if you're stressed out, you can get all this information, but how do I coordinate this? Where do I start? What do I pick up first? So within those aging and disability resource centers, or those area agencies on aging, they all have case managers and social workers who can actually go through and create a plan with you on all the different areas that you need, whether it's, trying to create your plan for your physical health, trying to create a plan for your loved one's social needs, for their transportation needs, their meal needs. So tap into those services and know that there is a social worker who can go visit somebody monthly, biweekly, and typically whatever the need is, those social workers are able to help. As far as, individuals in long-term care facilities, my heart goes out to people caring for someone in a facility and you can't go visit. I don't know how I would do that if I was in that situation. But knowing that as a caregiver and your loved one in the facility as a care recipient, they have rights. So in the District of Columbia, most facilities, if not all, have access to devices for virtual visitation. Right? So tablets, if there isn't that, there's a phone, right? So there's no reason why somebody in a facility, regardless of their healthcare needs, or if somebody doesn't like them in a facility, why they shouldn't be able to get a virtual visit. So if that's not happening, know that every nursing home facility has access to what's called an ombudsman, and that's in every state, but specifically the DC long-term care ombudsman represents and advocates for the rights of people in nursing facilities. So tap into the DC long-term care ombudsman, and I'm going to give you that number. That number is 202-434-2190. Again, 202-434-2190. And I just want to make one more point that, while you have the right to virtual visitation, you also have a right, if you're the caregiver, to be present during care planning meetings, right? So just because you can't go visit anymore, you're out of state, doesn't mean if your care recipient wants, or you're a guardian, that doesn't mean that stops. So you should be at the table. And AARP and Legal Counsel for the Elderly, we actually just developed resource sheets, which will be up at the end of this week, so tomorrow, that outline, those rights and how to tap into advocacy resources like the ombudsman if needed.
Okay, thank you. Thank you so much. You have referenced self-care frequently throughout our conversation. And we know that self-care is very important when taking care of others. And even if one is not, self-care is still important, but especially in this climate, we want to make sure we're taking care of ourselves if we're balancing caregiving. How can caregivers navigate this journey, this COVID-19 journey, with services such as adult daycare facilities being closed?
So, like I was saying earlier, there's so many people who they're doing caregiving and they don't identify as a caregiver, right? And there's some that don't realize that there are resources to assist you. So make sure that you ask your friends and family for help. Ask your church members for help. You know, somebody may not be able to provide, for example, you know, they're not able to provide grooming or bathing to your loved one, right? But they may be able to, you know, take your $50 and go to the grocery store for you and pick up your groceries, which is an hour task. Explore things like going to the wash and fold and have them wash your clothes instead of you doing it if you can afford that. Just tapping into being creative, right? But then in addition to that, making sure that, again, I know the message is kind of the same, but tap into different organizations and resources that are readily available to kind of offset, you know, the in-home care and respite services are important.
Thank you. And what do you believe are the most effective self-care strategies?
Yeah, so, you know, health and wellness comes first, right? If you're not taking care of yourself, you're going to find yourself sick, right? Or you're going to find yourself not able to care for a person. So just understand that your health and wellness comes first. You know, make sure that you're being easy on yourself. You know, whether you know, you had a frustrating day, your care recipient was, you know, upset at you because they were having some cognitive impairments and they got frustrated with the communication. Just make sure that you're easy on yourself and forgive yourself and then move on. If you need to sit in a room and cry for 15 minutes, give yourself 15 minutes to go sit in a room and cry. Don't be pigeonholed to your emotions. Let that out. And then also make sure that you're tapping into support groups. That is important. I know, you know, we think we don't have time, but sometimes that hour can make a huge difference between you tapping out and saying, I can't do this anymore, and being able to reset and move forward.
Thank you so much. Thank you so much, Brittany. Now we're going to transition to the question and answer. And I'm going to bring Eleanor Sellers in. She typed a question in the chat. Eleanor?
Yes.
Okay.
I was listening to the comments about the club memory programs, and I was wondering if there are similar programs in other areas other than DC.
Yes, so a great resource to find what resources are available. I would either use AARP's caregiving resource page, or if you don't want to go there, you can go to the Alzheimer's Association. They are able to tell you by state, by county, which resources that are similar to Club Memory. Of course, those support groups, those social clubs, where those are and how to access them.
The person just wrote in and asked, how do you suggest handling reporting cases of neglect during this environment?
I suggest that you, I suggest that you do it right away. You can contact Adult Protective Services. So if you type in any state, Adult Protective Services, you know, you're able to identify the point of contact for that. Our resource pages, like I said, those will actually be up tomorrow. We created that because we did a teletown hall on caregiving, especially in long-term care facilities, and how to access resources. And what was just brought up was one of those questions: how do I identify an advocate, but also how do I report cases of neglect, abuse, and exploitation? So Adult Protective Services is your best bet and where I would go, because they are the people who directly report those cases. The other thing is social workers in nursing home facilities, long-term care facilities, and even at home health agencies. And let me just say this, not just social workers, but you know, in the healthcare space, most licensed professionals, they are mandatory reporters, right? So if you tell the social worker that there is an issue with abuse, neglect, exploitation, they are required to report that. If you don't feel comfortable and like they are not doing that, please reach out to Adult Protective Services and they will be there to assist you. If it ends up being nothing, it's nothing, but it's better to report than not to, and then find out something horrible later.
you. So we're going to wrap up, but I want to just have you highlight again. You mentioned briefly, if you could just tell us a little bit more about the census advocacy work and the voting work that AARP DC is doing. And that's so important. We have an election coming up, and I just want to conclude with that and allow you to share closing remarks.
Okay. So the census. First thing first, please complete the census. It is so important to complete the census. Thousands of dollars go to, and every state is a little bit different, but some states, it may be 12, upwards of $17,000 per person per year for the next 10 years who completes that census. So please complete the census. You can complete it by phone. You can go online to complete the census, or you can, complete it by paper, but please make sure that you complete it. Our office has been doing lots of work surrounding the census. We have reached out to faith-based organizations and distributed faith-based bookmarks that talk about the importance of completing the census, right? We have partnered with Busboys and Poets to, a lot of people don't know this, but the Busboys and Poets in Southeast DC, they actually have a senior breakfast, which is free, by the way. They serve pancakes and all types of stuff, but yeah, and it's free. Yeah, but they, but we use that as an opportunity to, provide information on the census. So we've been tapping in various ways, prior to COVID, and now we are doing, of course, tapping into communities, putting out digital information on the importance of completing the census. And we most recently at the DC, it's a DC Park Up, which is a drive-in short-term movie situation at the RFK Stadium. We displayed a video as a reminder from our state president, please complete the census. So like I said earlier, our work does not stop, and we have been heavily engaged, boots on the ground. When it comes to voter engagement, we have been coordinating a series of trainings. So like I said, we have 4 trainings that we are doing for the general public. We will have those. I suggest that you follow us on our social media pages, AARP DC or at AARP DC. We have a variety of trainings that we will be deploying in the community. Those will be virtual via WebEx, so you are more than welcome to attend. And we're also promoting things like being an election day worker if you're healthy enough to do so. So tap in to those voter engagement opportunities, understand the different points of entry to be able to actually vote, whether that's absentee ballot or in person. And if you have any questions, you can always email me at bkit@aarp.org. Again, bkit@aarp.org.
Thank you so much, Brittany. It was a pleasure to share this time with you this evening. And I do see, before I close out, I see someone has typed something. Okay. Eleanor typed again before we close out. Are there any online support groups for Alzheimer's caregivers?
Yes. So if you tap into prior to COVID-19, what were in-person caregiver support groups, many of those have transitioned online, right? Or are doing weekly check-ins. So don't be scared to look up in-person support groups and call, and you might find out that they're actually transitioning and doing those support groups via Zoom or via WebEx or Skype. Also, again, specifically the Alzheimer's Association, they have online support groups that existed prior to COVID-19. So all you have to do is, call those places. And again, tapping into aging and disability resource centers. I'm actually going to give out the number for the one in DC. That number is 202. Actually, let me make sure I have that number right. 202-724-5626. They can help you identify a virtual support group, and that's the Aging and Disability Resource Center at 202-724-5626.
Thank you so much, Brittany, and I look forward to working with you again in the future. Thank you, everybody, for joining us via Zoom and Facebook Live. Take care of yourselves. Be safe. Until next time, God bless you all. Have a good
Have a great one.